Hello, my name is Sam. This is going to be my head-to-toe assessment. This is my brother Micah, who I'll be doing the assessment on. So to begin, I would start off with gathering all the necessary supplies, ensuring the patient's privacy, washing my hands beforehand, putting on my gloves, which I got here, and checking his two patient identifiers to make sure I have the right guy. I would shut his door, draw his curtain, whatever I got to do to ensure privacy. Then I would start off by obtaining his vital signs, getting his height, his weight, and as well as asking if he's in pain, because that can change vitals and all that. Are you in pain?
No pain.
Okay, great. I'm going to continue with, first I'm going to start off with asking him a couple questions. What's your day? What's your name, sir?
Micah.
What day is today?
September 20th or 30th.
And you know where you are?
Ivy Tech Hospital.
So he's alert-oriented, times 3. Great. I'm now going to continue to inspect your head for lice, lumps, lesions, any discoloration, anything that's not supposed to be there. All is well on that front, so it seems. I'm now going to continue with checking your ears for drainage, excessive wax, pain, drainage, lesions. Since he's an adult, I'm going to pull up and back on his ear. Does that hurt?
No.
Okay. I'm going to come over it to this side, up, back. Everything looks good. I'm now going to check his nose and his mouth and his carotid arteries. So let's start with the nose. No deviation, no drainage. Looks good. I'm now going to inspect his mouth. It is moist, it is pink, no discoloration, nothing wrong there. We're going to now check his carotid arteries, and I'm also going to check his eyes. Let's go carotid arteries first. One hand at a time, one carotid artery at a time. Regular rate, regular rhythm. We're going to check the other side. Regular rate and rhythm as well. And before I continue moving lower, I'm going to go with the eyes. Okay, so just looking at them, they look equal and round. I'm going to have you watch my light. Without moving your head, please follow. Just going to come closer. Okay. Now I'm going to check for the light. See if they're reactive to light. So just look straight ahead for me. Okay. Now look at the top of my ear. And then look at the wall past. Okay. So his pupils are equal, round, reactive to light, and accommodating. Before I continue with his breath sounds, his abdomen, his bowel sounds rather, I'm going to do his radial pulses and inspect his upper skin, as well as his bilateral strength. Let's start off with radial pulses. Okay, they are bilateral, equal in strength, and a regular rhythm. We'll do the capillary refills. Perfusion is good, it's not sluggish, it's color's coming back under 3 seconds. Raise up. Oh. Yep, got the order wrong, but that's all right. There we go. I'm going to check your skin for... I would now check his upper skin for any discoloration, bruises, any lumps, anything out of the ordinary. I'm going to check his temperature on his skin first, though. Looks well. Now we're going to check skin turgor. So I'm just going to pinch a chunk of his skin. It bounces back. It's well hydrated. It's not sluggish. While I'm thinking of it, I'm going to go ahead and move on down to his feet and do the exact same thing. And I'm actually going to move my phone. Okay. So to start us off, I'm going to have you press. Okay. Ooh. Great. I'm going to check his capillary refill. Oh, let's get you over. Check his capillary refills on his toes. Okay. I'm actually just going to pull your socks off for a second. Sorry. Supposing the dogs. Okay, his perfusion looks good. It's not sluggish at all. I would now check his dorsal pedalis and posterior tibialis pulses. Okay, so they're equal, bilateral equal in strength and regular rate and rhythm. They go on the inside. Okay, regular rate and rhythm as well. And while I'm down here, of course, I would be inspecting his skin on his lower extremities as well. Good. So we're going to continue with the assessment, getting the heavy hitters, breath sounds, abdominal, bowel sounds, and apical pulse. Since I'm touching his feet, I'm going to change my gloves. Minute of this video is just me struggling with these gloves. Okay. So apical heart rate, I'm going to count it for 1 full minute. It's going to be on his left side, left mid-clavicular line, 5th intercostal space. Let's zoom over here. 1, 2, 3, 4, 5. Okay. I would record that for 1 full minute. Note the rate, the rhythm. Rate, rhythm. Rate, rhythm. If it's a regular rhythm or irregular, which in this case it's regular. That's good. I'm going to continue with the breath sounds and the vowel sounds. Okay. So let's do breath sounds first. So start here. Have you been coughing?
No
Okay.
cough.
I'm gonna have you stand up and turn around. Do the posterior breath sounds. Yeah. The first one was 10 spots. This one's gonna be 18, so 9 on each side. 1, 2, 2, 3, 4, 5, 6, 7, 8, 9, 7, 8, 9. Okay, I'm now going to have him lean forward. I'm going to check the curvature of his spine. No wheezing, no rasp in his breath sounds. You can straighten out. Spine is also straight. Okay, and if I'm thinking correctly, last but not least is his bowel sounds. So he has a sweater on, so I'm not going to have him raise it up to inspect it, but in a normal clinical circumstance, he would have to raise his shirt up so I could visually see it. But for the sake of this, I'm just going to verbalize. I'm inspecting his stomach before I touch it, before I listen to it, before I palpate it, because I don't want to activate bowel sounds in a false way, I guess. So I would inspect it first, but then listen. His bowel sounds are active and present in all 4 quadrants. I'm now going to palpate. Tell me if any of this hurts.
No pain. No pain. No pain. No pain.
Okay, and when was your last bowel movement
Yesterday.
urination?
Yesterday.
Okay. Palpate his bladder. And I believe that is it. Thank you.